Good afternoon. I hope everyone is doing well on this wonderful Friday with the weather being so nice and generous to us. I want to take an opportunity to thank you for joining us for this important announcement. As mayor, my focus is on building a community where people feel cared for, supported, and connected to the resources that they need to live longer, healthier lives. That's the vision behind our Live Longer in Lawrence. This initiative is very important to the city of Lawrence, and today's launch of the Crosswalk to Care program is a perfect example of that vision becoming reality. Let me say that again. Today's launch of the Crosswalk to Care program is a perfect example of the vision becoming reality. Starting September 15th, when you call 911, you'll have a new option for situations that may not require an ambulance or a trip to the ER. Trained nurses, navigators can connect you to the right kind of help: a clinic, telehealth, mental health services, or even a safe ride to an appointment. I want to be clear, nothing changes in an emergency. If you need immediate, life-saving help, you will still get it. What's new is that for less urgent situations, you'll now have another choice, one that can mean faster answers, less stress, and better outcomes. This program is about dignity. It's about making sure that when someone dials 911 in a moment of uncertainty, they know that they will face or won't face that moment alone. And it's about compassion and innovation working hand in hand to improve the health of our city. I want to thank Fire Chief Bob Wallace for bringing this idea forward, Dr. John Kunzer for his leadership in shaping it, and our partners at Crosswalk Health for making it possible. I also want to recognize our communication director, Melanie Castile. Without her and her team, this is an important partnership. They are a critical role to our 911 center. Crosswalk to Care is what it means to live longer in Lawrence. Smarter care, better options, and a healthier future for all. This program wouldn't be possible without the dedication of our first responders. To share more about how this will work in practice, I'd like to invite Chief Wallace to speak.
Thank you, Mayor. Good afternoon, everyone. As Fire Chief, my foremost responsibility is to protect the safety and well-being of our community. Today, we take a bold and important step forward in fulfilling that mission. I am proud to announce the launch of Crosswalk to Care program, a partnership that reshapes how we respond to 911 calls and how we care for our neighbors. The truth is that not every 911 call requires an ambulance or an emergency room, but until now, those were often the only options. Crosswalk to Care changes that. It gives our citizens additional pathway to faster, smarter, and more appropriate care. It ensures emergency resources remain available for life-threatening events while connecting others to the right kind of help, whether that's a nurse, a clinic, telehealth, or even a safe ride share. This is more than about efficiency. It's about equity. It's about making sure every resident has care to the care they need when they need it, regardless of circumstance. And let me be clear, this program is better for patients, better for our emergency system, and it comes at no cost to the taxpayers. I could not be prouder of the team that made this possible. Division Chief of EMS John Moore and Deputy Chief of Operations Brian Funk, whose tireless hours brought this program to life. The City of Lawrence Chief Medical Officer Dr. Kunzer for his insight and leadership. Our EMS Medical Director Dr. Paige Ostahowski for integrating these protocols into the system. And the team at Crosswalk Health, whose expertise and collaboration were instrumental in implementation. Also, I'd like to thank Police Chief Bigsby and Communication Director Castile for their leadership with our public communications team. And then finally, I'd like to thank Mayor Whitfield. Her vision and leadership made this possible. Without her commitment and to reimagining on how we serve the community, we would not be here today. Her Live Longer Lawrence initiative has truly transformed how we approach community wellness and care. This is the future of emergency response. More options, better outcome, greater equity. Same 911 call, smarter care. Thank you, Doctor.
Good afternoon, John Kunzer. I'd first like to set the record straight. Chief Wallace and his team deserve all the credit for this initiative. My contribution was, he asked me, is this a good idea and does this fit with Live Longer in Lawrence? And I said, this is a great idea and it absolutely fits with Live Longer in Lawrence. So Live Longer in Lawrence is the initiative that Mayor Deb Whitfield has launched to have citizens in the city of Lawrence live longer and live healthier lives throughout their entire lifespan, from birth to senior citizens. She asked when we launched this program to make sure that the interventions that there were systematic interventions, that they were community-based, and that they have outcomes. And that's why I think this program fits so well with those goals of Live Longer in Lawrence, that this is truly a system-based solution. In healthcare, we often talk about the best ideas deliver 3 wins: a win for the patient, a win for the provider, and a win for the health system. In this case, this is a win for the citizens of Lawrence. This is a win for our EMS providers, our emergency rooms, and it's a win for the entire city. The Crosswalks to Care, a system solution where it gives people the resources that are available throughout Lawrence. Lawrence has tons of resources. Sometimes our citizens just aren't aware of what's there. Sometimes some of our citizens think the only place to get care after 5 o'clock is an emergency room. The emergency room is not where you want to be unless you're having a life-threatening emergency. As you all know, those physicians and providers there are fabulous, and their job is to treat life-threatening emergencies. But if you have other things, if you have dental care, mental health care, preventative care, those are much more better served outside of the emergency room. And so where the system solution comes into play is these nurse navigators are going to connect these citizens to those available resources to provide a continuity, long-term care, to get some of that preventative routine care. And it's more convenient for the citizens. You don't want to be in an emergency room having to wait a long time as they treat more acute folks. You can get your need treated that same day, next day. It might be by virtual. You might not even have to leave your home. So this is an exciting program. I really do think that we should take a moment just to feel proud about the city of Lawrence, because this leadership is just fabulous, and that the chief got this idea and brought it forward. The partnership with Crosswalk to Care is fabulous. But I think just to really give kudos to Mayor Deb Whitfield, because this doesn't happen if you don't have the head person of the city saying our goal for the city is to improve the health and well-being of the city and make that a major initiative. So really thank you, Mayor, for this.
All right, that concludes our presentation today. Thank you for coming, and we're excited to get this kicked off. Thank you.